Welcome everybody to our panel discussion today about an update on the Sanag Specialty Hospital in Somaliland. We are very excited to have our panel here with us to provide this update. Some of us are here in Utah, others are actually in Somaliland on site at the hospital, which is very exciting. With us today is Sheldon Wardwell, our strategic sourcing manager, who's been overseeing this project for the past couple of years. Diana Carson is founder and managing director of ResponseMed, who has been our close partner and collaborator throughout this process. Dr. Russell Osgathorpe, who of course is our doTERRA chief medical officer. And then Dr. Hawa Farhan Farah, who is our Sanag Specialty Hospital head of pediatrics. Welcome to all of you. So great to see everyone. It's been too long, but we're excited to be together today on this panel.
It's great to be here.
It's great to be here. Thanks, Tim.
Sheldon, let's jump in with you on the first question. First off, could you just tell us, why are we working in Somaliland? Why is this hospital being built there in particular?
Sure. So first, for those who may not know, Somaliland is located in the Horn of Africa. And within Somaliland, there's a mountainous region called Sanag, which is one of the few places in the world where frankincense and myrrh trees grow. And Sanag is one of the main harvesting areas where we source our frankincense and myrrh resins from. Sanag also happens to be one of the most remote and undeveloped regions in the world. The communities here have suffered from decades of intermittent conflict, drought, and famine. There's almost no infrastructure in the region, and most of the population, which is over 500,000 people, do not have access to quality healthcare services. After learning of the dire health situation faced by the harvester communities, doTERRA Healing Hands committed over $3 million back in 2017 to help establish the Sanag Specialty Hospital. So this is what has kept us here over the last couple of years.
With so many of our resins coming from this unique and special area, it's amazing we're able to have the hospital now being built and available right in the heart of where all the action has been happening. Dr. Osgathorpe, can you maybe elaborate a bit on the challenges faced in this area of Somaliland and why having a hospital, particularly at the caliber of that's being built there? Why is this going to be so groundbreaking for this area?
Yeah, I'd be happy to. The hospital is going to be a pillar of this community upon which the community will be able to grow. I'm really proud of doTERRA's contributions in this area and feel that they will impact, like Sheldon was saying, hundreds of thousands of lives. Specifically, the lack of infrastructure that exists is pretty stark. The community has been doing its very best to provide health care, but there are many needs. The region has one of the highest rates of infant and maternal mortality in the world, according to the World Health Organization. And this hospital will play a major role in trying to curb those terrible statistics. Dr. Hawa, as our head of pediatrics, who I was able to interview last year when she applied for this job, is going to be on the front lines of caring for these children. Together with our partners with ResponseMed and others, we will be making significant contributions to a part of the world that really desperately needs this type of infrastructure and access. They have a great healthcare system in Somaliland. This will provide better access to the folks there that have not had access in years past. And it will change those infant mortality rates and maternal mortality rates within the first year. After the hospital opens, I really look forward to coming back and reporting to the group on how we've done in making those changes that we've set as goals.
Thank you so much, Dr. Osgathorpe. Could you tell us also a little bit more about some of what services are going to be provided at the hospital, and maybe a little bit more about some of the other doctors and staff that are amazing and we've been able to bring together?
Sure. There's going to be a maternity ward with a nursery. So those are going to be the two main drivers of changing infant and maternal mortality in the region, along with the outreach that doctors Mona and Hawa and Mohammed will make in the region, going out and visiting local communities. That outreach portion of the hospital will be really key to building trust and providing that access that is so desperately needed to change those levels of mortality for infants and mothers. Then there's also going to be an outpatient unit, an inpatient unit, a surgical unit, and an emergency unit. And these units will all be independent. We can take you on a tour, I hope, in as a part of this video that'll allow everybody to see exactly what we'll be doing out there and how we'll be doing it. But it is going to be a full service hospital providing both primary and many aspects of secondary care with a full access lab and radiology suite as well.
It's amazing. And it's so hard to convey to everyone how amazing and unique and life-changing, life-saving truly it'll be to provide those types of services and the level of service in this remote of an area of the world.
On that point, Sheldon and I were on a phone call the other day where both of us actually, when we saw the shipping containers with all of our equipment arrive, both of us were emotional because with that equipment, we can now be a hospital, and it made it all the way there safely. And anyhow, Sheldon, that was a moment, was it not?
It was, yeah. It's been a really long, hard journey to get here. I don't think a lot of people understand how difficult it is to set up a hospital in this part of the world, let alone sort of implement any project in this part of the world. And, you know, so many of us have had our entire lives focused on this project for the last 18 to 24 months. And we're finally getting to that point where we can see the light at the end of the tunnel. And so it was a relief, especially amidst all of the added complications of COVID, which interrupted things and stopped us from getting our team in on the ground. And so we definitely felt relieved when we finally got the equipment there and a couple of our guys on the ground. We've got an amazing guy from Response Med who's been leading the way while everyone's been out, named Kevin, and we, you know, the team's been amazing, and we've been finding a way to make it happen.
I just can't thank our partners from Response Med enough. Diane, you guys are amazing. And from back here in Pleasant Grove at doTERRA headquarters, we just want to express to everyone involved in this project how grateful we are. The sacrifices that you guys are making to make this project a reality, with especially Dr. Hawa and Mona and Mohammed leading the charge there on the ground in Sanag, is just really, it's inspiring to me. As a pediatrician, to be even peripherally involved as I am in a project such as this is incredibly important to me, but I know that it's also important to our owners and to the company as a whole. So thank you for all of your hard work, Sheldon and team, Diane and Dr. Hawa. It's really important.
Thank you, Russ. We're having lots of emotional moments as we get closer to the finishing line.
We're almost there.
Yeah, this is truly the true meaning of the word collaboration in all aspects of everyone bringing in their strengths and resources and expertise and building a dream team to pull this together. And it's probably safe to say that the shipment of these 3 containers with this specialized medical equipment is probably the first time this equipment has ever arrived in the Sanag region. And for it to be able to function correctly also soon will be monumental.
I was just going to say that equipment actually is state-of-the-art equipment as well. It's not that it just hasn't been in that area of the world. There are incubators for infants, oxygen delivery systems, ventilators, laboratory equipment, x-ray equipment, ultrasound equipment, cardiac equipment, monitoring equipment, all of it arrived overland. And it's really quite remarkable. This will allow Sanag Specialty Hospital to function as truly a leader in Somaliland. And Dr. Hawa will be on the front lines of providing care in that unit in a world-class facility, treating these people. I'm really proud of what Sheldon and Response Med with Diane and her team and the local team has been able to accomplish. It's nothing short of miraculous.
Dr. Hawa, we're again so excited to have you on board as one of our lead family physicians. I understand you're a graduate of the top medical program in all of Somaliland. Could you tell us a little bit about what made you go into medicine and what it means to be involved with establishing the Sanag Specialty Hospital?
Yeah, sure. So first of all, thank you for having me here, and from my family physician teams, we are all saying we appreciate your kindness and in implementing this in Sanag region. I like to be in medicine since I was little, and actually my parents just encouraged me to do medicine. And one of my dreams was to become a lovely, merciful doctor once in my life. So that was why I actually become a doctor. And I love reading and enjoy updating myself and to help the community become a better place for the people.
Thank you very much, Dr. Hawa, for your expertise and commitment to your country and this region. And we are, as has been mentioned, so grateful for your contributions to the team. And you'll be such a key part of all the treatment and especially oversight and management of the medical services that will be provided there, together with, of course, Dr. Osgothorpe and other physicians that will be advising and training and helping along the way too. Dr. Howell, can you maybe elaborate a bit further on the impact you think this hospital will have on the community, particularly within the pediatric department, which you'll be leading?
So from my perspective and how I observe it, the region here, I saw that many disorders are increasing in rate, like malnutrition and infections, which eventually will lead to anemia and eventually will lead to increased mortality rate, child mortality rate. So from what I'm seeing is that this hospital and this region especially needed such big hospital with a lot of facilities that will help the community from the sickness, like with all the equipment and all the staff and doctors in there, so that people will at least have the care that they should have in their society, instead of going from eastern point of Somaliland to the western point of Somaliland just to get minimum care that they should be getting in their community. So I think that this hospital will mean a lot and change a lot in this region.
Sheldon, you've spent now a couple of years now, including many weeks and months being on the ground. Can you tell us a little bit about how this development came, and maybe highlight one or two of the challenges, just one or two of the long list, but maybe one or two of the challenges that we've had to face along the way?
Sure, Tim. And I just want to highlight again that the credit for this project really belongs to the whole doTERRA Healing Hands team and to our amazing partners on the ground. And without all of them, it wouldn't be possible. It was our local partner that originally initiated this project to help improve the lives of our harvesters. And Response Med, which you've started to hear about and which Diana will speak about more in a moment, they've been instrumental to the implementation of the project. And from the onset, it was clear that one of the biggest challenges that we faced would be finding a team of medical and technical experts that was both capable and willing to help set up the hospital in this particular region. Most international organizations and companies will not allow their staff to operate in this region. For example, all the UN agencies do not allow their staff to travel to Senag because it's considered too dangerous and too remote of a frontier environment. Just to get here, which we arrived just yesterday, it requires driving 12 hours, which you have to spread out over 2 days because you're not allowed to drive after dark. You have to have constant armed force protection from special police unit and soldiers, and you have to get permission to make any kind of movements from the government. But nonetheless, despite all these challenges, over the last 18 months, we've achieved something I'm very proud of as a team. We've began with a thorough needs assessment, and through that, we designed a package of essential health services that we're going to be offering at the hospital that are focused largely on child and maternal health. We've completed construction now of one of the most impressive facilities in the entire region, including the departments that Dr. Osgathorpe mentioned a few moments ago. We successfully sunk a 380-meter borehole, giving us water in an area which many thought wasn't possible. And we procured state-of-the-art equipment. And then last and most importantly, we've recruited one of the best medical teams in all of Somaliland, including Dr. Hawa and two of her other classmates from the top medical program in all of Somaliland. So we're really proud. It's been a really long journey. As Russ mentioned, it's been a little emotional, I think, for all of us to finally be nearing the next step to where we can open the doors.
Tim, my favorite moment was the borehole. When they found water, a reliable, long-term source of water in that community, that was a big moment. When I saw that water gushing out of the ground, that was pretty awesome.
Dr. Hawa, I know you hear from the community a bit more. Can you make a comment about the community's reaction when we hit water and what it meant in this area?
Yeah, that area was like, people didn't think that they will have a water there. Even there are some families who live there, but they used to get not clean water for a long period. So people was happy to see a water in that area. Like people were saying that it's amazing, like a miracle to have water there.
Yeah, made headline news for a couple of weeks there in Somaliland.
Well, I mean, getting that drilling rig, which is a specialized piece of equipment, overland to the hospital to drill that borehole was miraculous. It shouldn't have occurred. It occurred. And then we didn't know there was going to be water there. We just hoped. And we had to drill a long ways. And we got all the way down there and found a reliable, long-term source of water, which the region has really never had. So it's a major game changer. Not only, but I mean, that kind of shows what this hospital needs. There's not a power grid that's reliable. There's not water. So the hospital has to build things from the ground up. It's not just a building permit and a set of contractors. It's finding water, finding power, everything.
And there's even some infrastructure we've had to put in place, like refinishing and fixing an old dirt landing strip that can be used for planes. Do you want to mention something on that for a minute, Sheldon?
Sure. Yeah. We were hoping to get Russ and Dave in here for the grand opening this month or last month. Everything's been pushed back because of COVID-19. We will still make that happen, but we are resurfacing an old airstrip so that we can start landing airplanes in here for the first time in years, and that will sort of open up a new sector of the country.
And the airstrip would be able to allow visitors, of course, like Dr. Oscar Thorpe or Dave Sterling or others that will be, involved from doTERRA, but also for bringing in supplies that might be urgently needed, but then also bringing in at times trained expats that could better access this area through this landing strip to provide training, support services to the medical team there. We really want to make this a global initiative to help provide the very best training and services to this area through this hospital.
That's a really important point, Tim. There are so many medical needs that are the result of old traumatic injuries, even years gone by, where legs are fractured, tib fibs or femurs, and they don't heal correctly, leaving the individual with a very difficult life afterwards, or birth trauma, where a difficult delivery results in a woman who cannot control urine and they're incontinent continually. And these sorts of procedures can be taught to our physicians, like Dr. Hawa, and they can become very competent and well-trained in these procedures through our partnerships with Response Med and other folks back here at home in Pleasant Grove who are anxious, like myself, to go and give expertise and time to our medical teams on the ground so that they can provide even a higher level of care over the years as our reach increases in SONAG.
Great. Thank you so much, Russ. Diana, I'd like to turn to you for a minute. You have such extensive experience living and working in Eastern Africa, particularly in the healthcare space. Can you tell us a little bit about Response Med and your experience in delivering medical support in some of the most remote areas in Africa, and what it's been like to be involved with helping to establish this hospital here?
Thanks very much, Tim. Response Med provides medical support to companies working in remote and hostile environments, and our management team has over 40 years of experience in delivering medical support to a cross-section of these projects in countries like Western Sahara, Chad, Kenya, Ethiopia, Somalia, Somaliland. So we're fairly used to
it's just the easy places.
Yeah, the easy places. We like a challenge. I'm not sure I could work on a medical project in an easy part of the world. I think what's been quite different for us on this project is historically we've supported multinational workforces working in the extractive space or the renewable energy space where they're working in the middle of nowhere, and we set up their medical infrastructure for them and support them on sites. Whereas this project has given us the opportunity to impact the lives of thousands in a community that's been so underserved for so long, and it really is going to create real impact, and that's been really exciting for us and a very different project in terms of the ones that we're used to. So that's been really, really good for us, and we continue to enjoy it. And Russ, to your point, we're having more and more of those goosebump moments. We're getting there finally.
What's been your favorite moment, Diane?
The borehole was also a very big one. I have to say the borehole was huge for all of us, and then knowing that the containers were safely in Berbera was also a relief, but the greater knowledge that they'd actually gone along that road and made it to Erigava without incident. These roads are really, really tough, and there are lots of accidents, and you can see sometimes when you drive down them a vehicle that's rolled or a container that's fallen off the back of a truck. So I was even more delighted about the fact that they'd safely arrived in Erigavo. We've got one more coming in next week, and that will be another moment.
I wonder if people understand just how important water is for medicine. You really can't do much of anything in medicine without a clean, reliable source of water. Without it, you can't clean wounds, you can't sterilize things, you can't provide care, you can't clean a hospital. Water really is the foundation of everything. When we found water, that made everything really possible. And
Russ, I think it's also about the sort of real impact that the water is going to create around the hospital, and we've been having conversations, through COVID and the need for greater hygiene and the fact that people haven't had access to water in order to be able to instill daily hand washing routines and sanitization. The impact is going to be felt so much further afield than the hospital alone, which is really fantastic.
I agree. And even to riff on that a little bit more, there is so much water that we found there that the local community will have access to water now for their households, for livestock, and like you said, washing your hands to decrease the spread of diseases like COVID-19, but all diseases really that are spread through hand washing failures are now going to be able to be impacted because of a clean, reliable, long-term source of water. It really is going to change the game in the region.
And then another ancillary benefit too is just the fact that water was able to be hit. We now know the water table in that area and can map out more effectively so that even other surrounding communities can do the same and have, drill a well with less risk involved and less cost involved. There's just that ripple effect too of knowing water is available there. Water is obviously absolutely critical for all things health. And so being able to forge the way and show where water is accessible will also lead to other communities benefiting.
One of the projects that Sheldon and I are working on is potentially taking water to outlying communities and extending the reach of that water. They will help us potentially accomplish that task. Moving water is no small feat, but if we can move water around, it will definitely increase the reach of the hospital, allowing more people to understand that the hospital is present, that we have really good, reliable providers of healthcare there, like Dr. Hawa, and that will further impact the type of infant maternal mortality we want to see change over time.
Diana, thank you so much. Having Response Med involved with this project has made all the difference, and we are so grateful for your expertise, direction, and leadership, and even spending many weeks there on site, being able to help bring this all together. Could you maybe just highlight a little bit further some of the amazing things that have happened, the miracles, but then also the challenges of operating in a place like the Sanag region? And you are an expert in working in remote areas. What makes the Sanag region even the most remote of the remote from your past experience?
Yeah, I mean, it is really, really remote, and I have to say one of the most remote and challenging and interesting and rewarding projects that we've worked on. I think the highlights are numerous. It's been such a pleasure meeting doctors like Hawa, Mona, and Mohammed, and bringing them on board, and they're really excited and proud to be starting to work at the hospital. And then obviously all the very many moving parts that have finally arrived in Erigavo, and we have our last few coming in next week. And that's not a guarantee, in terms of sending a shipment from A to B to C, there are no guarantees. So we're delighted that that's all happened and gone according to plan. I think some of the challenges for our team on the ground have been working with a construction team with no technical expertise, working with subcontractors who haven't delivered on their contracts, a few too many misunderstandings with regards to comprehension given limited levels of English, as well as a very different work ethic. I think the challenge we're all very, very well aware of is having got over the hurdles of importing everything and getting it cleared. We were all ready to mobilize. Some of us were on the way to the airport and we were hit with COVID-19, which obviously delayed our April opening, but also put an extra scope into the works in terms of extra policies, procedures, guidelines, PPE procurement, in order to make sure that the hospital could also be prepared to manage COVID. I think the biggest highlight for all of us at ResponseMed has been working with doTERRA and the Healing Hands Foundation. We really have felt like we've had your unwavering support, encouragement and commitment throughout this project, and that's quite unique and rare. We haven't experienced that working with many other partners, and we really, really thank you for that. I think what the biggest highlight that we're looking forward to working on with you going forwards is obviously building capacity and making a difference and contributing to the sustainability of the hospital going forwards. And we really want to thank all of you at the Healing Hands Foundation for giving us the opportunity to work on a project that gives me goosebumps every day.
The feelings are mutual. Thank you so much. And as I mentioned earlier, this has truly been a collaborative effort and would not be possible without your involvement. And we really feel so fortunate to have brought the dream team together to make this happen. Sheldon and Dr. Osgothorpe, can you tell us a little bit more about what's in place to ensure that this hospital will be sustainable, not just for the short term, but for many years to come? Maybe Sheldon, you can address that for a minute, and then Dr. Osgothorpe after Sheldon.
Sure. So the long-term sustainability of this hospital has always been our top priority, and achieving this is going to be dependent on a few major factors. This includes making sure that the services of the hospital align with the community needs, and that we have the capacity to deliver quality services and build trust with the community. This will require recruiting and developing a world-class medical staff. We've already been successful in recruiting one of the best medical teams in all of Somaliland, and then moving forward, working closely with Russ, the focus is going to be on continual training and capacity building. And then financially, we have external donor agencies have already expressed interest in supporting the hospital once we're up and running, and we're exploring different opportunities and ways to offset our or reduce operational costs, such as by installing solar power in the near future.
Yeah, and I would add to that, Sheldon, that some of the challenges we face in making this project long-term sustainable so that this hospital is providing care and expanding its reach over the next 20, 30, 40 years will be having partners on the ground. ResponseMed is one of our first partners. We're looking at trying to find more partners, NGOs, governmental agencies, non-governmental agencies that will partner with us. And to do that, one of the first things we can do is start reaching out to both the Aragavo, which is this main city in the Sanag region, and then the smaller townships around the area, and gathering health data, particularly on maternal and infant pregnancy and follow-up data. So just simple things like tracking individuals through a pregnancy is something that's not been done in the region. And if we can show our potential partners that we can reliably track women who are pregnant and offer to them a reliable method of delivering a child in a hospital if they get into trouble, is going to be a major contribution to the area. And when we can publish that sort of data and show the World Health Organization and others what actual numbers are on the ground due to the efforts of our local medical teams, that is going to attract lots of non-governmental organizations who want to work in the region but don't have a reliable partner. And so we will become that reliable partner in the region, basically the only reliable partner in the region. Healing Hands remains committed to the long-term sustainability of the region and the hospital, but having more partners make us even more strong.
Thank you. It truly is taking a village, many villages, so to speak, but having, many medical or, international medical organizations involved as well. Many are very eager to be able to deliver services in these areas. They just haven't had the framework or, trusted partner or the ability to deliver them. And so we're hoping, to continue to build this, network that will be key in ensuring the long-term sustainability of services in this area. Russ, can you highlight maybe some of the medical institutions that we're working with to help maybe even provide training or telemed support to the medical professionals in the hospital?
Sure, but before I do that, can I highlight one other thing?
Please.
The long-term sustainability of the project requires really more than what we just touched on. It requires a local team, both medical and operational, on the ground that are native to the region. It's not going to succeed without a partnership, but having a local medical team that lives in the region, grew up in the region, understands the region operationally and medically is really key. So Dr. Hawa and the governing board and then the local board of the hospital are one of the structures that make this project more likely to succeed in the long term. This is not just Healing Hands parachuting in for a few years. This is establishing a financially stable hospital that the local community has a say in governing and running. And that makes it much more sustainable in the long term.
Yeah, it makes all the difference if there's not local buy-in and they are not just feel like they have a voice, but they're actually involved with the governance structure and the board. You're absolutely right that this can't be a parachuting in fix. It needs to be a long-term, community-led, community demand-driven hospital and organization and operation, but led by and integrated directly in with the community.
So in terms of that question you asked me about partnerships that are going to help expand the hospital's reach, we have been in discussions with local universities here in Utah, as well as healthcare organizations around operational governance and supporting this hospital with potential specialty support. Myself with infectious diseases, others with cardiology or surgery or radiology, things that we could use technology to augment Dr. Hawa's ability to care for a patient at the bedside locally in Somalia. Technology makes that possible, whereas only 15 years ago that wouldn't have been very possible. Today in this region, obviously we're talking over the internet with folks right on the ground in our hospital. So we have the ability to do telemedicine right there in the region, which will help Dr. Hawa provide world-class care right there in Sanag.
Yeah, it's amazing being able to connect the medical professionals and institutions that we'll be able to do, and also to provide interns or residents or young aspiring doctors to be able to have access and reach to an area of the world that would not be possible otherwise, to provide public health services and in an international development, developing country context.
Yeah, and over time, I would imagine that even the Somaliland and Somalia infrastructure, the medical infrastructure that exists, the medical schools that exist, may want to utilize the Sanag Specialty Hospital for training in the future, which will be something I will be interested in trying to tie in the Sanag Specialty Hospital to the overlying infrastructure within Somalia. We're all trying to do the same thing.
Sheldon, last question. And as you mentioned, you guys were just able to arrive there post, COVID travel restrictions just yesterday. So there's a lot has been happening, a lot of momentum building up, but can you tell us what are the next steps? When we'll be able to do at least a soft opening of the hospital now that you guys are back there on the ground?
Sure. So, as we mentioned, we just arrived yesterday with quite a large team. We've got about 10 medical professionals and technicians with us. We're here to go over all the final works and to install equipment, put the management systems into place, stock up the pharmacy. Over the next few weeks, we'll be hiring around 60 local staff, and we're planning to have a soft opening sometime in September. And then hopefully soon thereafter, after we work out a few of the kinks, we'll be able to get Russ and Dave out here on an airplane and have a proper grand opening ceremony. I know that we're short on time, but I wanted to say one last thing. As I was driving yesterday, the translator told me something that the driver had said, and I had been, I've been focused on this project for the last 2 years of my life, and I've been sort of picturing the situation this way. But the message that I got from the translator, of which the driver said in Somali, was that we're shining a little flashlight in this dark side of the world, and that right now it's just a small light, but that he sees it really growing. And I see that we've accomplished sort of the foundation to build on, and we've got all the right people in the right place. But this hospital is so much more than just a hospital. And in addition to the livelihood opportunities that we're providing through our resin sourcing, I believe that in the years to come that we're going to really transform this entire region.
Thank you. Yeah, this has become a pinnacle of sorts of the co-impact sourcing model, with Somaliland and particularly this region being in such underdevelopment and in great need of not only economic opportunity but better and better access to healthcare facilities. This just provides an incredible opportunity for us to be able to source the best and help the most in a truly, impactful way for a community, a region that's going to service, up to 500,000 people. I mean, that's massive. And being able to source resins, in a sustainable way, the frankincense and myrrh resins that come from only this area in the world. This is the place where these trees are endemic and grow. So being able to organize our harvesting efforts in a sustainable, fair, and co-impact model way, but then also to be able to combine that with significant resources from Healing Hands Foundation to build an infrastructure like this hospital to deliver, key primary and secondary healthcare services is exactly what co-impact sourcing is all about. And we're so grateful for that opportunity. This has been such a great discussion and panel. We could go on, I imagine, for another couple of hours at least. But wanted just to thank all of you again for all of your contributions to making this happen, especially to Diana and Sheldon and Hawa and the other doctors that are there making this happen on the ground, but also Dr. Osgothorpe, your direction and leadership has been absolutely critical to making this come together as well. We're so excited about the coming month here where we can do the soft opening, but also for the grand opening as soon as that's feasible. But thanks for giving us this insight, update onto what's been happening. And we obviously look forward to bringing everyone more information and videos, and other media assets that will help everyone see the big day, bring this to life and bring this to everyone's home so they can see the culmination of all these efforts. So thank you so much, everyone. Again, stay safe wherever you are, and we'll look forward to further updates. Bye-bye.
Thank you.
Thanks, Tim.
Bye-bye.
Bye, guys.